see why they might think it was a problem of expedience.
Why are edibles inconsistent or sometimes unpredictable in the effects or experience that you get when consuming them? You know, sometimes an edible can be uplifting or stimulating, sometimes relaxing or sedating, calming, sometimes in the middle or a mix of those two, and sometimes in the worst case scenario, even cause paranoia or anxiety if you overconsume and take too much of an edible. So in this video, we're going to break down a few different things that you can consider and look at to make sure you can get a consistent edible experience and also be able to predict how you're going to feel the next time you consume an edible. Do you think there's any risk in, so another thing I see is nano encapsulation around the cannabinoids for edibles, and it's supposed to bypass that metabolism stage in the liver, and the bioavailability is much higher. That's kind of the marketing pitch for it. Is there a risk in bypassing a mechanism in our body that's there for a reason? But if you do it sublingually or inhale, technically you're also bypassing. So is it same, or is there something different there?
Nope. I think there is always a risk because it's all about dose. As Paracelsus told us in the 14th century, any drug at high enough concentration is a poison. So if the goal is to encapsulate it so the concentrations get higher, there's a risk if you're not careful about the dose. But that's precisely what we do when we smoke, when we inhale, when we do sublingual or oral. What we're trying to do is bypass that. And certainly there is quite a cottage industry of nano encapsulating cancer chemotherapeutic agents, for instance, to allow them to last a little bit longer, to maybe put some tags on those nanoparticles to get them to the target where we want them to go. So yes, there is a risk, but I think it's well worth developing the technology. Just we got to do it in a logical fashion. So when you nano encapsulate, how much do you reduce the dose to avoid toxicity? Yeah, you can nano encapsulate and it'll increase its potency or its efficacy is what I should say in the body, but it could get into a toxic range more easily as well. So I think it's a valid way to go, and certainly in the long run may help us design better approaches to using cannabinoids for therapies.
You said prolong the effects for nano encapsulating maybe some of those other like cancer treatments. The marketing I've heard is that it has fast onset, so it's almost like sublingual within 15 minutes. Everyone's trying to make this 15-minute edible that will, you'll start to feel the effects of sooner, but that's how it's pitched, in which I would think would mean less duration of effects if it's activated sooner.
So that I'd have to see the data. I think that's apocryphal. It's like saying delta 8 is a milder high than delta 9. That's based on one paper with 4 patients 50 years ago. Right. We need to study this in more detail, but what would happen is you're protecting it, and so it will get through the liver better, because what happens to it is that the cannabinoids, when they're naked, are very highly protein bound. They're sucked up by the proteins in our body, including the liver. By encapsulating them, it's almost like you're making them invisible. They get through the liver faster, or they get through the liver during that first pass. And then if they disintegrate, if these nanoparticles disintegrate once they are absorbed, then I could well imagine it potentially could be faster, but I'd have to see the data. The key is, are the blood levels higher in the nano-encapsulated cannabinoid, or is somebody just saying, I feel it faster? Those are two different things.
Yeah.
I'm not saying they're wrong. I haven't seen that in the literature.
And would you not get the 11-hydroxy THC conversion, most likely, if it was nano-encapsulated?
That's correct. Okay. Until it got into a tissue that had the enzymes that do that, these cytochrome P450s.
So that 11-hydroxy happens in the liver at the those enzymes mostly.
I'd have to double check that. Those enzymes, by the way, are all over the body. It's just the liver is, multiple pounds of meat that's there to do this. It's a machine. Yeah, it is a machine.
The blood work sounds like a key piece of that. If you start cannabis in larger doses or whatever it is, checking that blood work to make sure everything's in balance.
Yeah, the only problem with that, Wayne, is that for most of our drugs, we don't do blood work for them. We treat you until you're right, so little more, little less.
Right.
It's things that are very dangerous, like lithium and coumadin that we monitor so very closely.
Any blood thinners or anticoagulants.
Correct.
You're doing
Those
blood work
are
there.
things to worry about. Yep, exactly.
The enzymes that break down the cannabinoids when we're at the liver, and so it's obviously letting some into the bloodstream, and that's
Correct.
what's passing through. Is it regulated in a certain way, like the liver is saying, like, oh, we could use some of this THC to a certain amount, and then it says we don't want this much, it's kicking out another, or is it just a certain amount it lets through? Because it seems like if it's going in the bloodstream, it would let, if it passes some of it, wouldn't it just let all of it through? It's the same molecule.
Right. No, think of it as a filter. So it takes a certain amount out. So it doesn't consciously say we need more, we need less. So by way of example, if you take 10 milligrams of THC orally, you just eat a tablet or a capsule, about 5% gets past the liver.
Mm-hmm.
So instead of that, and we never knew this when we developed the modes of administration, when you smoke it, it goes to the lungs, into the blood, into the brain, and skips the liver the first time, right? The lung absorbs like oxygen, and it actually heads straight out, goes to the heart, then heads straight to the brain, and then to the rest of the body. So that's where the high comes from. You get a very high, when you smoke, very high concentration, very quickly. I think the sweet spot, so less than 5% is orally bioavailable. Only if you eat it, about 5% will get into the blood.
Mm-hmm.
If, however, you put it under your tongue or you put it in your buccal cavity with like a lozenge, then it gets slowly absorbed by the blood vessels in your oral cavity, and that also bypasses the liver at first. So you can achieve a slightly higher concentration. So I think what we do need to be doing is a lot more investigation about these other delivery methods. You could do the same thing with a suppository, for instance, or with a patch, because these will be absorbed much like nicotine is. You could do the same thing with a cream, or the development of these tinctures and oils and troches, these sort of gelatin-based tabs that you put between your cheek and gum. And so those provide for a slower absorption, but a more effective absorption than taking a tablet. But they're not going to give you the spike that would impair your judgment or produce euphoria. So I think there's huge value there. When we get into trouble orally, and we've heard these stories, it's when somebody takes a butter and makes it into brownies and then eats a ton of it, so that you're not taking 10 or 20 milligrams, you're taking hundreds or thousands of milligrams. Right. And then you end up with problems.
Yeah. I find the edible part interesting with the 5% actually gets into the bloodstream, because if you took that small amount, if it's 10 milligrams, 5% is a half a milligram. If you took that much inhaling, you wouldn't get the same high effect, like relatively. And there's that conversion that happens through metabolism where the delta 9 that you would inhale or eat goes to 11 hydroxy THC, which I've heard a number. It's supposed to be, it's a smaller molecule and maybe like 4 times more potent, which is probably arbitrary, but it's the bioavailability is lower, but its effectiveness, it seems to be going up. So there's almost like a balance there. Less gets through, but what does get converted is a lot more effective. Or
it gets metabolized. Those are called active metabolites. So you take it in, then it gets metabolized, and some of that is more potent. It's about the same size. It's not that it's smaller. It's just it has a tighter interaction with the receptor, which is what makes it more potent. But that also is a complexity that we haven't fully studied. Again, because it's a Schedule I drug and it's so hard to do.
You have to set up studies almost basically separately for like edibles versus smoking. You're really not looking at both inside of the same study then?
We're not, although it is possible to do both of them. You could design a study where you have one condition where they come in one day and smoke the cannabis, and another condition where they would take the edibles on a different day. One could design that, but because of the way our work has evolved, we have a history of doing the studies with smoked cannabis. Smoked cannabis is the predominant form way people use cannabis, so it's been more in trust with driving and other measures. So we, rather than sort of repeat what we've already done, we've designed studies with different routes of administration to build onto our past work. So we're looking at edibles or other routes of administration and comparing it to past work as well, or what's published, as opposed to designing them in one study. But that could be done, having it in one study.
Yeah. Yeah, the edibles are just the oral metabolism gets more complex because THC then converts into a different form of THC through metabolism, the 11-hydroxy form. And so, again, starting even if it's around that same dose, you're probably getting much different effects because now the chemistry is changing of what THC is in the body and being absorbed. So it gets really complex. Before we get into specifics of the study, kind of going to the back end, are there biomarkers or something that you're measuring versus just people consuming a certain dose that might be a little more subjective when it's in a joint or harder to control that dose? Do you check for anything like blood work on the back end?
Yes, absolutely. You hit the nail on the head. When you smoke a cannabis cigarette, you can't tell someone to smoke the whole joint because they could end up taking too much, a bit more than they can tolerate, and they can get sick. So we tell them to smoke to their usual level of intoxication, or until they, if they feel sick, to stop. Obviously, we don't want them to continue if they don't feel well. So to try and associate any changes in behavior that we see, we measure THC in the blood, and also the two metabolites that you just mentioned, the hydroxy metabolite and the carboxy metabolite. The carboxy is the inactive metabolite, whereas the hydroxy does have psychoactive properties. So we measure all three in blood, and we look at them repeatedly over the course of the session. So at 5 minutes, 30 minutes, and then hourly for 5-6 hours. And we look at the changes over time and associate that with changes in our behavioral measures, our driving, our cognition, our subjective experience, to see how THC influences or is associated with those measures. Something we're getting more interested in is CBD as well, trying to measure both THC and CBD in blood and oral fluid, and measure those two biomarkers at the same time as our behavioral measures.
Right. What were those three biomarkers? You said the hydroxy form, the carboxy, and there was a third one?
There's the parent THC, just the THC.
Oh, okay.
The active metabolite hydroxy, and the inactive carboxy, which is what we generally measure. But we're getting more interested in CBD as well, to try and measure both THC and CBD at the same time.
Right.
See what's happening with the two cannabinoids.
Yeah. And for listeners, the carboxy metabolite, that's what's most commonly used in like drug tests because it hangs around the longest. Although it's inert, it shows that some consumption happened. Is that accurate?
That's right. The carboxy metabolite is primarily excreted through the urine. So that's the metabolite that is found in those drug tests, the workplace tests and the drug police screening tests and so forth. That's what is found in the urine, and does have a very long half-life, which it does stick around for quite a long time. And there seems to be some relationship with how much you use. The more you use, the longer it seems to stick around in the urine. So that is what is measured in those drug cups.
Yeah. Could you maybe a simplistic walkthrough of those three biomarkers? If someone were to consume a joint in some of the studies you looked at, what is the normal timeline and kind of peak of each of those metabolites that you might see in somebody as time progresses?
So with the THC, when you smoke a joint, you would see the peak in the blood within about 5 minutes, 5 to 10 minutes. And the peak varies 20, 30, 40 nanograms per mil. It varies from study to study, but it goes just for some context, the legal limit in a lot of jurisdictions is 2 to 5 nanograms per mil in blood. So it goes way to 20, 30, 40 nanograms per mil within the first 5 to 10 minutes. and then it drops off. So within an hour, you're pretty much back down to your baseline levels, down to 2 to 5 nanograms per mil. And then even though it comes back down to baseline and it's sort of leveled off, we do see statistically and mathematically that it's elevated for quite some period of time. So it does stay elevated, even though it's on graphs, it looks like it's back down to the pre-smoking baseline. The hydroxy metabolite has a similar time course. It's a little bit more delayed. It takes a bit longer to peak. And then it has a similar sort of elimination, return to baseline. Within a few hours, it returns back to baseline. And the carboxy one is the one with the long half-life, so it sticks around in the urine, and it takes a bit longer to show in the blood, and then it also decreases after a few hours.
On the other hand, then you have people who have, chronic ongoing problems, and knee pain or back pain would be a great example there, where we know actually that inhalation is less good, right? Because while it's rapid in its onset, it's also relatively short in its duration. So you get this peak and then it wears off and the pain comes back and you peak and so you get this yo-yo effect. And what we know is that our brains, being the wily creatures that they are, start to anticipate the wearing off of the medicine, and the pain comes roaring back sooner and sooner and worse. And so the idea of using a short-acting medication for chronic pain is actually really not a very good idea. So what do? We go to the edibles, right? And because the edibles are processed through the liver, it actually converts the delta 9 THC into 11 hydroxy THC, which is now a different medicine with different behavior, and it is a longer acting form. So this is much better for those chronic pains. Getting a nice level treatment actually works better for the pain management.
I like that. I don't know if I've heard one pointed out as clearly, but acute episodic inhalation is kind of the direction you start. If it's chronic, you go towards oral consumption. And that's a very good kind of like fork to start with as you keep bridging down on your product selection and trying to figure things out for yourself. The sublingual piece seems to me to sit in between inhalation and oral consumption. Do you recommend that in certain scenarios, or do you view that as more like inhalation because it's a quicker onset but a shorter duration, or is it right in the middle? How do you think about sublingual?
I think that generally speaking, sublingual isn't really a thing.
Oh, really?
Interesting. All of the studies that we've looked at using sort of garden variety tinctures show that when people put the drops under their tongues, they get a Pavlovian response, right? They expect something, so they start to feel something.
That bell just went off right while you were saying Pavlovian response.
That's funny, and it's my mother.
Ironic.
It is. So, the point is people feel something because they've been told to expect something, right? That's a conditioned response. But if you actually look at the blood level of cannabinoids under those circumstances, you don't find any, right? When they swallow the tincture, then you get absorption through the gut, and then it's basically just like an edible. Mm-hmm. The other thing I don't like about tinctures is that they're liquid, right? If we recognize that getting the dose right, being precise about it is the most important thing, then a liquid is just an opportunity to blow it, right? I mean, did I get 4 drops? Did I get 6 drops? Did I get 27 drops? I don't know, especially when people are told to drop it under their tongue like this.
Can't even see,
so
yeah.
There are times when I use tinctures, don't get me wrong, they're just rare. And when I do, and it's going through somebody's mouth, what I tell them is take a spoon and count the drops onto the spoon, and then take it like a cough syrup just down the hatch. Mm-hmm. That way we don't have people holding this nasty stuff in their mouth. We know that they're getting hopefully a more precise dose. And the other time I end up using tinctures is that there are some people who can't take things by mouth at all, mm-hmm. and they have a tube through their belly, and you can't put a gummy through the tube, so you put the tincture through the tube.
Yeah. Is the issue that the absorption through the mucus glands just takes too long if it's in a carrier oil or something? So you end up just swallowing it. You'd have to wait 30 minutes by holding it in your mouth to actually get absorption. Do we know?
everything is always everything is always a matter of dose and time, right? So in theory, if you held it long enough, you might get some absorption. Similarly, if you put enough in your mouth, you can force that equation. A great example is if you take a cannabis concentrate like, shatter or butter and rub it on your gums. Yes, you'll get high because you can force enough through there. But if you look at the dose that you put on versus how much you get into the bloodstream, it's a tiny fraction. It's terribly wasteful, and it's unpredictable and all that sort of thing. A lot of the discussion about sublingual or other forms of intraoral absorption come from the pharmaceutical literature. We know, for example, that GW, right, pharmaceuticals, has Epidiolex and Sativex as their main products, and they've worked really hard to make this work as a buccal spray, meaning you spray it on the inside of your cheek and it gets absorbed there. But the thing is that they work really hard on that, and they've used a whole lot of very sophisticated techniques involving suspending the cannabis in a mixture of oil and certain types of alcohol. And the alcohol's job in this case is to actually, how do I put this? It's really basically to rough up the inside of your cheek so that the natural protective abilities are undone, and that allows the medicine to more reliably pass through. But then if you also look at their studies, what you find is the number one reason people drop out of the studies is because they develop oral sores, right? And that are uncomfortable and unpleasant. So the question for me is there a reason to use this method with its problems? It would have to be somehow better than either going by inhalation or by direct oral.
And then a big one for edibles that I think a lot of people don't know about or they forget about is the consumption method. If you orally consume an edible, the effects kick in 30 to 45 minutes, maybe 60 minutes, and then they last a little longer. So on these graphs we have down here, we have inhaling cannabis, so smoking it, orally consuming an edible, which is the most way we normally, eat an edible. But the other one that's really interesting is sublingual consumption. So tinctures, most people put under the tongue. They act a little faster because they don't go through the digestive tract where they have to metabolize. They go through the mucus glands, kind of like how chewing tobacco works. And it kicks in quite a bit faster. Sublingual is really in the middle between smoking and orally consuming an edible. But the effects are shorter than orally consuming an edible, but a little longer than smoking. And so it's a really cool way to get different effects because you're not metabolizing it. So terpenes seem to be more bioavailable if you do it sublingually. And also the effects, again, kick in a little faster. And then there's a whole chemistry process that happens when you digest an edible, and THC converts to different forms. And when you sublingually consume, that doesn't happen. So the high is different, not just that it's faster and doesn't last quite as long, the experience will also be different. And so one thing we really like with our caramels is they can be consumed both ways because the caramel will melt if you left it in your mouth or under your tongue. So we have some people, like for sleep, when they're going to bed, they'll eat their dose of caramel, but then they'll take another piece and let that melt under their tongue. So they feel it in like 10 to 15 minutes. And then the one they orally consume lasts longer and kind of helps them sleep all the way through the night. But yeah, a lot of tinctures are used sublingually, but a lot of edibles can be too, especially like lozenge or anything you would suck on and not like chew on. You'll get those kind of effects from it. Do we have any customers that ever, like consumption method, think about this or talked about it or aware of that? I don't see a lot of customers that know. Yeah. Yeah. The effects are noticeably different. Like kind of what I'm doing, what I'm looking for during the day or at night, I'll consume our caramel differently, either sublingual or orally consume it. It's noticeably different. On the sales side, I keep this really simple. There's two questions that I always recommend asking with a customer coming in. And we'll talk about edibles, but this really applies to like any type of product when they're coming in. So the first one is always the use case. So what are you looking to use cannabis for? Even if someone comes in and they're like, oh, I want your strongest sativa, you can kind of reply with, oh, what are you looking to use it for? I'm guessing you want something uplifting, like are you going outside, looking to clean the house? That really changes like what kind of product type. And some people might exactly know what they want because they've used it before, they like it. But some of those people are kind of in the middle, are not sure. Why do they want to use it? Sleeping through the night really changes versus wanting to be creative and, you know, paint or draw or something like that. Big difference there. And then the second one that's huge, especially for new consumers, is their experience level with that product. So someone could have smoked 10 years ago a couple times, kind of like, oh, I understand cannabis, how it makes me feel. If they're going to an edible and they've never had an edible before, it's really important to ask, like, what's your experience level with this type of product? And do you know your dose? Where's that at? If people know it, that's awesome. But if you kind of sense some unknown or they're a little confused, definitely try to walk them through that process a little bit more about dose. And especially for edibles, over-consuming too much THC in an edible is a lot more of a kind of overwhelming negative experience. You can get to that edge of like paranoia and freaking out that you can't really get to with smoking. There's kind of a ceiling there, but edibles, when it metabolizes, that's that chemistry process, it turns into, instead of delta 9 THC, it converts to 11-hydroxy, and that one is really potent. It can be really psychoactive. And your body could take hundreds of milligrams of that, and it's going to process it all. And, I mean, for my upper limit is around 30 to 40 milligrams, and I consume pretty normally, almost daily. And some medical patients probably have a much higher tolerance. But a new consumer that hasn't tried an edible, that could put someone off forever after that, and probably away from cannabis as well.